So today I'm going to discuss the 4 different parts of Medicare. These are really important. You need to know this before you start Medicare, so this video is very important. But first, my name is Brian Monahan. I've been a licensed insurance agent working with people going on to Medicare and on Medicare for over 15 years. Here's my phone number on the screen. It will also be in the description box if you need to contact my office and ask further questions. So the 4 different parts of Medicare. There's A, B, C, and D. It sounds pretty simple, but A is your hospitalization. B is your medical, which means doctor's office, outpatient centers, and so forth. C is the Medicare Advantage plans, and D stands for drugs, your Part D prescription drug plan. Now let me separate these parts. So the first 2 parts that you have to sign up for are Medicare Part A and B. Now, you do this through the Social Security office before you're 65, so a few months prior to being 65. I'd say 2 or 3 months. Call the Social Security office, call an agent like myself, call someone who can walk you through it. This will be much easier when you do this. But when you sign up for Medicare Part A and B, you'll get a card that looks like this that came on the screen. And this will have your Medicare number and your Part A and B start date. These things are very important. The thing about it is they give you Medicare Part A and B you have to pay for, but it doesn't cover 100% of the costs. So the second decision that you have to make is whether you want a Medicare Advantage plan, which is actually Part C, or a Med-Sup supplement plan, which is separate from Medicare, but it's pretty much in competition with the Medicare Advantage plan. So that's the second decision. We'll call that the Part C. Then your fourth is Part D. Now, when you do that second decision after you have your Medicare A and B card, if you decide to get a Medicare Advantage plan, they group everything together. These are PPOs and HMO plans. They will put your vision, dental, and hearing, your prescription drug plan, and your hospital and doctor all in one. This is kind of like the plan that you've been on your whole life. It's grouped all together. But if you decide to get a Medicare supplement plan with that A and B card, then you have to choose between different plans. I won't get into that. There'll be a link in the description box also that will have my different videos that explain these different plans and so forth. So you can click on that link down there. I'll also have it up on the screen, the playlist that you can go to at the end of this video. But if you choose a Medicare supplement plan, you then have to attach a drug plan, Part D, to it, and a vision, dental, and hearing plan to it. So let me recap this whole thing. First thing you need to do, there's 4 parts: A, B, C, and D. A is hospital, B is medical, C is Advantage plan, and D is drugs. First thing you need to do is sign up for Part A and B. You do that through the Social Security office. Someone like myself can help you if you don't know how to do it. Once you get your A and B card that looks like this on the screen, then you'll either choose a Medicare Advantage plan or a Med-Sup. If you choose an Advantage plan, then you're finished with your package. Pretty much all your Medicare needs are covered. If you choose a Med-Sup, then you'll have to choose which plan you want. Then you'll have to get a separate Part D prescription drug plan and a separate vision, dental, and hearing plan. I know this sounds really confusing. It's actually not. It's pretty simplistic, but most people need it explained to them. You don't want to read thousands of pages that they send you in a big, thick book about Medicare. It's easier to watch these videos and talk to somebody who knows Medicare. So like I said, I have a playlist that explains all these different things in different videos. Click on that playlist or click on this video with the playlist that will take you to more videos that I've done. Thanks for watching this video. I'll see you at the next one.